Okay, why don't we get started? Welcome everyone. Thank you for joining our webinar today, Improve Your Workflow, Insider Tips and Tricks for NextGen Success. My name is Gary Jacobs. I'll be your moderator for today's event. Before we get started, a few housekeeping items. You'll all be in listen-only mode throughout the presentation. If you have a question for our presenters, please enter it in the questions window on your control panel, and we will get to some of your questions live today as time permits. We can follow up with you after the webinar to address any of your specific questions that we don't answer on this call. Today's presentation will be recorded, and we'll be sending you a link within a day or so that you can review the presentation. Why don't we meet our presenters? Randy Dweck is an EHR consultant here at MedTech Solutions. She's got over 20 years of experience in the healthcare field. She's trained and supported EMRs in both inpatient and outpatient facilities. And as you'll see, she really understands the ins and outs of the NextGen EHR. Randy will be joined today by Dr. Gary Witicha, who came to us recently from a long tenure at NextGen. He now serves as MedTech Solutions Chief Medical Officer and the clinical voice of our organization. Dr. Gary, I think you'll be kicking us off. Right?
Yes, thanks, Gary. Hi, everybody. Dr. Gary here, and we have a lot of content to cover today. So we're going to be giving you a number of tips and tricks and things that you may or may not know about in the system. We're going to show you how you can apply them. We're going to talk a little bit about what it means to use these things and how it's going to impact your provider's life. But as you see this list that we have here, we're going to start off with looking at the assessment and plan has a copy forward capability. We're going to talk about putting lab results into a document. The ability to do this really has helped providers, and it's a great thing that NextGen put into the system. We're going to do some encounter history, tips and tricks. We'll get into my favorite, the medication module. We'll talk about some of the images and what you can do with images now in NextGen. And then we're going to go all the way down to the end there where we are going to talk about viewing someone else's inbox as necessary, especially for when providers are out of the office or you're covering for someone else. So as Gary said, I'm joined today by my friend Randy, and we're going to start off talking about a feature that's been around for a little bit, but a lot of people aren't aware of it or they skip over it. And I want to bring it to you, we want to bring it to your attention. And this is the ability to copy forward your assessment and plans from previous encounters. And this is great because a lot of times providers want to see what they wrote the last time, and the assessment and plan is staying the same or fairly similar. This is one of those documentation things that can really speed up the provider's documentation. In the next versions of NextGen, they're going to be adding a lot more of this copy forward capability, but it's already there for you in the assessment and plans. So, hi Randy, how you doing today?
Hi, good, thank you. How are you?
Doing really great. So why don't you walk us through this copy forward capability that NextGen's put into the assessment and plan panel?
So providers will see this DX/AP history button, and when they click on it, they will see the previous assessments and plans that were documented. You can see it for other providers as well, what they documented, and you can select the same assessment. So if you're going to address the same concern, you can click on the assessment and it'll apply to today's visit. You can select more than one, and then when you're done, you'll click close, and you'll see that these assessments populate in the grid.
And what's really important there is, I'm going to go back a slide here. With this, notice that the assessment and the patient plan, if they did a provider plan, it would be there for them so they can see that. And if they documented any impressions, they could also pull that forward into today's assessment and plan. And this is great. What they would then do is, once they have it there, do they have to live with it as it is, or is there a way for them to clean it up or add additional information, Randy?
Right. This is not set in stone. So let's say 80% of it is a similar instruction that you want to repeat again today. You can come to the assessment plan or AP details tab, highlight your assessment. You'll see the plan on the bottom, and you can edit it there. So you can, in the box, again, edit the plan that's already written. You can also add a phrase. So if you have your My Phrases created, you can add multiple phrases to that specific assessment.
Yeah, and that makes it nice, quick, and easy. You can take what you've already written, modify it, and if you wanted to add on to it, if you've already created an add-on My Phrase, you can pull it in. So this really speeds up documentation for the providers. So that was the copy forward. Now let's talk about inserting lab results into a document. And as I look back over my career and having patients' lab results come back and then trying to get that information in to the document so that I could talk about it further, it's pretty tedious. And so what NextGen has done is it has given users, providers and end users the ability to insert lab results into the document where they want. So walk us through this, Randy.
This is a very nice feature, and once providers see it, they really like it. What you can do, like we said, is adding lab results into your note. So first we'll want to generate the note. You'll find the area you want to insert the lab results, which may be around your plan. You'll just click in that area. You will right click and you'll see a couple options. You'll see the Insert Lab Result option. You'll click there, and then you'll get a pop-up and it'll show you all the lab results available. In my example, we're addressing diabetes, so the provider can choose the last couple results. Maybe they just want the last 2 results for hemoglobin A1C or any values you'd want to add. You'll just check the boxes. It will show you the value. It'll show you the date, the collection date. You'll check the box, and then you'll click OK, and then those will insert into the document.
What's really important here is that you have to make sure you know where, and you are clicking into your document where you want this to populate. So if you clicked in the wrong place, you will have this inserted where you did want it, and you'd have to back it out. But what's really great here is we brought over information, and it really allows the provider then to document. In this case, if you look at the A1Cs, this patient's tracking with an A1C of 5.9, so they're fairly well. They're well controlled. The medication's working, and they can then continue with their plan, making reference to, in this case, into the patient's lab values that are there. So this is a really great feature. It's a speed up, and it also helps keep things moving for the provider, and also gets rid of that tedious typing in and trying to make sure that you get it in correctly. So this is a great tool to use for that. As we go forward, let's talk about encounter history. So there are things that can really help in making the encounter history easier or clearer for your end users. So let's talk about the search feature, Randy.
This gives us the opportunity to find basically anything. We can type in a word or multiple words, and again, it's just a magnifying glass, which is our search in the encounter history. We type in a word, and it's going to show us the documents that contain that word. So if we double click in the in one of our findings, it'll open up that document. This might be, I'll give you an example. If here I wrote psychiatrist, maybe our patient is asking for a prescription for Cymbalta, and you remember, they're seeing another provider that manages this. So if I just type in, let's say psychiatrist, it's going to show me the documents that contain this word. Again, I can click on one of the documents, it'll open up, and I can see what I wrote before.
Yeah, this is a great feature, and many people miss this because it's kind of lighter than the rest of the words there. Another example of how you could use this is you're working with a patient and you know you've talked to them about chest pain in the past. What encounter was that? This helps you to search all the documents where there was a conversation on chest pain, and then it would allow you to then look through the encounters that directly address that. So this search feature really helps speed up and helps navigate all those encounters that a patient has had. Another is the refresh button, which a lot of people are missing this because it's all the way over to the right. Tell us about this one, Randy.
This is a great time saver. This, again, refreshes the encounter. A great example to use this would be if you generate a document offline. Many times users will select File, Close Patient, go back to your inbox, find that chart, open it again. This will refresh the encounter so that you'll see, again, anything we've changed or put in new. So in this example, we'll see the note that now populates in the encounter. If we created a custom encounter, and we'll look at that in a bit, we will click the refresh and then that will fall in chronological order. If we have to change, let's say we're going to the encounter maintenance screen and we have to change our rendering provider, any changes we make, they don't show right away. So if we click the refresh, it quickly will update our encounter and show us our changes.
Yeah, this is a time saver. If those of us that have used NextGen for a while, you know, you had to go away, come back. Also, if other people have done things in the encounter since you've opened the encounter, this refresh could be where your nurse had done something with the patient or somebody else did something with the patient. It would bring it up into the encounter for you as well. So it is another time saver in NextGen to allow you to do that refresh. So my favorite, medication module. Let's talk about some tips and tricks here and things that just make life easier. Let's talk about prescribing alerts.
We can add a prescribing alert the same way we add any other alert. We will click our alerts button and go to the prescribing column, and we can select an item from the checklist or we can type something in. My example, I just put no narcotics and the patient sees another doctor, Dr. Harrison, for pain management. So this way, if they're asking us for specific medications, we have notes saying, maybe who manages these, the conditions that they're asking us for medications for.
Yep.
And
go ahead.
I'm sorry. A lot of times when we open the chart and we see these alerts, we just glance over them or we don't remember, by the time we get to the medication module, what we read.
Okay, great. So there's how you add the alert, and then this is where they can see them. So tell us more about this prescribing alert here in the medications module itself.
So we have the same alert here, and if we hover over it, we can see what's been added. So for example, we're reviewing the medications with our patient or going through refilling medications, and they might, ask us, can I have a prescription for hydrocodone? But I'm hovering over and I see, nope, somebody else manages your pain. You should ask that doctor for that prescription. Again, any other alerts, prescribing alerts we can see here, just so you don't have to go back to the alerts or remember, try to remember what first popped up when you logged in.
Yeah, this is a great tickler for providers as they're navigating through the system. As Randy said, you get in there, you see the alerts, they go away. Well, for medications, you want those alerts to be there when you're about to do something with medications. And so as you can see, it's right there. And the hover over just makes it, you don't have to click on anything, you just hover over it and it gives you the information of any of those alerts, prescribing alerts that are there. So let's talk about this. This is an exciting one because this really enhances the workflow between your assessment plan details and the medication module. Tell us more, Randy.
When you're in your AP details, we have a button on the right that reads medications, and if we click that, our medication module will open. This saves time because very often the provider's looking at the assessments, closing it, going to the medication module, closing that, going back to their plan, maybe changing a medication, adding a medication, then going back to the medication module and then adding it there or making any changes. This saves them from going back and forth. What will happen is the medication module will pop up. You'll see your assessments and you can hopefully do it all in one shot. You'll see what you're changing. You'll discuss it with the patient. You can do it there, talk about the next problem, update your medications. Maybe at the same time, you can close that medication module, type something more in your plan, click the button again and get the pop-up. Again, it saves you from closing your plan and then going back to the module and again, going back and forth.
Yeah, and that is a major provider satisfier there. Getting to the medication module and realizing that you didn't have an assessment in to associate with your meds, having to go back and forth, closing. It was a lot of clicks. This just makes it a lot quicker. It brings it exactly where you're using it. So it speeds up and it reduces the number of clicks back and forth that you have to do. So moving forward, let's talk about adding images to an encounter. And so this is an important one because sometimes there are images we've documented, we want to pull them in, or it could be the patient's given us an image, but it really is all about adding the images so that they're available and linked to the encounter. So tell us more about this one, Randy.
This is something that I've noticed providers do like because a lot of times you need to reference something. And this might be just an image maybe taken in the office, before and after pictures. Images also mean documents. A lot of times these are PDF documents. So this is a way maybe somebody emailed you something. You don't have to print it out and scan it in. This is a different or hopefully easier method. What you'll do though to access those images is it's through our image module. We'll click that and we'll get a pop-up asking, which image do we want to pull in. So I have it saved. This is my desktop. It'll most likely be on your server desktop. You'll save it there. I'm going to select my image and then I'm going to click OK or open and it will come into my encounter. We see it here in our encounter and I'm going to click Save. Once I click Save, I'm going to get a pop-up asking what I want to name it. So this is nice so I can identify it. Patient might have sent you something and it says my arm, but you don't want to save it as that. So you can name it what it really is, or here it's a foot ulcer. So we're going to click OK, and then that will save into the encounter. We also have an option if you want to add it to the category as well. So in the same area, when you're saving the image to the encounter, there's an option, if you see on the very bottom, show categories, and if I click that, it shows me our available categories, and I'm going to select the category that this image should belong to. So in this example, our patient sent us some test results from another facility, and we can save that to A, the encounter, B, the category, all at the same time. And that shows us what it looks like in the encounter.
That makes it really quick. So you're tackling adding it to the encounter as well as making it available in your categories, which just speeds that up. Think about how you would have done that before, the double dipping, and you couldn't even really pull it in. So this really speeds up the process and makes it a lot more efficient for your providers and team. So saving images from the patient portal, what I'm finding, what I'm seeing out there in the healthcare world is patients are starting to communicate with their providers, sending in images of things. It may be a rash, it may be a form, but they save these in, they send these in, and now you want to bring it into the patient's record. So why don't you go over what it is, or how you would save an image from the patient portal message?
When you receive a message from a patient, if they've attached an image, you'll see a paperclip. There is a column for a paperclip, and if you see a paperclip there, it lets us know that there's an attachment.
Oops. Yep. Sorry.
Okay.
Keep going.
So what we'll do is we'll open that message. We're going to, of course, save this image. So initially, we just have to accept it. We'll see the attachment. We'll click the attachment tab to see that, and then we can click add to chart. We can right click add to chart. It'll give us a pop-up, what category do we want to save this to, and we're able to, of course, select the appropriate category. So again, it's nice, we can just save it to their chart. And then in here, it's just my example. The patient sent us a picture of their arm where they have a rash, and it saves to the encounter and to the category.
Great. Once again, that speeds up something that used to be many clicks and cumbersome in the past. So we're now going to talk about inserting images that you have into a document. So this is actually adding it into the document that you may be sending to another provider, or you're just saving it into today's encounter and document. So how's this done, Randy?
This I'm going to also piggyback on maybe what our patient sent us or any other image that we have. We're going to, again, generate the document. You're going to find the area you want to insert that document. You will right-click, insert patient image, and then you'll get a pop-up listing all the images that are saved for that patient. And then I'm going to save that rash that the patient sent us. So I'm going to select that image, and then that will populate in our document.
Once again, the important part there is make sure you click into your document where you want it to be. I can guarantee results, and they'll get used to it. So the first time or few, you want to make sure they're paying attention to where they've inserted it, but it becomes second nature after they've done it for a while. So moving forward, let's talk about the creation of a custom encounter. First of all, why would somebody create a custom encounter? And is it everybody, or is it require access rights to be able to create custom encounters?
Right, not everybody can create a custom encounter. It's if you have the correct access. Very common is, one example is, let's say, a telephone call. Maybe you were too busy to document it at that day or that time, or there's anything you need to add, and let's say days went by. This allows you to create your encounter for the date and time that you need. I'm going to click File, New, and then I'm telling the system I need a custom encounter. This allows me to create, to select the date and time that I need. It gives me a calendar. I click the ellipsis, I select the date, and I can select the time. Sometimes you forget to document something, like I said, like it's now Monday and we forgot to document something from Friday. So if we click New, it's going to give us the current date and time. As we're here, again, we can select what date we need.
Yeah. So your organization, your practice probably has reasons that you're currently creating custom encounters. And this is a new way to do it that makes it easier and quicker for you to be able to create it and set it into your patient history. So, and then this right here is just what it looks like in the patient history. Anything else on this, Randy, or should we move forward?
You can move forward, right? The example here is today is the 27th, but I needed an encounter for the 25th. So just to show you how it does display in chronological order.
Yep, great. So another favorite of mine is the PAQ. And we're going to talk about sign off with actions. And while this isn't new, a lot of people struggle with it. They haven't set up their actions. But this here really speeds up the process of having a provider sign off on things and then initiate the next steps with a single click. So let's talk about what this is and how you do it, Randy.
Okay. Providers will see on the bottom, you have a button that reads sign off with actions. In my example, these are actions that I created. Normal labs, make appointment to review their tests, telephone call, which I'm going to explain, like open up the telephone call template. So we can create basically rules for ourselves. When I click one of these actions, do what I instructed, what we created. So an example is I've saved one that's called normal labs. So something that is repetitive for providers, where you might say, ask your MA, can you call this patient and tell them that their labs are normal? We're telling the system what to do. One, create a task. Assign to, I'm telling the system who to send this to. It can be one MA, maybe you want it to go to 3 MAs, and then what are you asking them to do? Please call the patient and let them know their lab tests are normal. You do not have to type this out every time for each result or every note, and you can create as many as you need. So I'm going to create this once, I will save it, and then when I select that action, these instructions will go to my MA. Another option I have on the right is, let's say I need to call the patient regarding something. I'm going to tell the system, open that patient's chart, create a new encounter, launch the telephone call template. And then from there, I can obviously document the telephone call template and also use my phrases saved there, something else that will save us time. So it saves you from clicking chart, new for a new encounter, and then opening up that telephone call template. So this will do it all for you in one click.
This really speeds up the process for providers who are trying to get through their PAQs and keep the PAQ numbers down. What's great here is for the normal labs, if the protocol in your practice is, if it's normal, the nurse MA is going to call and the provider's already done his or her part, they can click the actions initiated. It already sent over this message as a task to the nurse to handle it, and the provider signed off on it. They're able to move on to the next one and handle it. This really helps your providers to rifle through and get through all of that, all the things they have to sign off on in a given day. So this is a great one. Now, viewing someone else's inbox, and there are many reasons why somebody would want to look at somebody else's inbox. One might be that the provider or individual is left and you want to make sure all their tasks and everything's been handled. They may be on PTO, on vacation, out of the office, doing something somewhere else. So there's a number of reasons to have this. But there's some ways to set this up that make it really quick and easy. So Randy, walk us through this one.
So like Gary said, users, you can set this up so that users can view each other's inbox. You have to have the rights to do this. Usually you'll click on admin, workflow manager, and if you see user, that's just for yourself. Your manager may have access to the administrator option, which lets them lets them assign somebody else, lets them assign access for anybody in the office, versus user is just for yourself. So our manager is going to assign access to somebody's inbox. In this example, we have a provider. Let's say our provider is going to go on vacation or they might be leaving. We can say, okay, I want Dr. X, Dr. Y to also view that provider's inbox. We would select their name on the left, click the ad, and their name will display on the right. On the bottom, we have an option, use only when out of the office. So if we have that provider's name highlighted at the top and we do have the out of office, we really don't have to worry about this because it's every time that provider's out of the office, these other providers will have access to that provider's inbox. And we can also do that with the provider approval queue, the tab on the left, where providers can view each other's PAQ. The workflow for the users, the manager will select the user's name and then give access to other users to view that user's inbox. As Gary said, they may be on vacation, they may be out sick, so it's a big help so that they don't really miss anything that another provider sent or things that have come in to their inbox.
This is really great for those workflows. You know, a provider's in surgery and something needs to be done. Their partner or somebody else who's a delegate for them can then go in and handle things while they're not available to do so. And it really is, you know, what is the provider at that time? Are they in the office, out of the office? Are they scheduled for something? It allows this stuff to become activated. So once it's set up, it's ready to go, and it'll stay that way until you change it. So that's what we wanted to cover today. Gary, are there any questions for us?
Yes, we have a few. Thanks for those great tips and tricks. Hopefully folks in the audience will find some value in what you presented, and we'll go back and be able to save some time, make their workflow a little more efficient. Let's address some of their questions. First is, you mentioned receiving messages from the patient portal. Can MTS help set this up for us and manage who receives the messages?
Randy, do you want to take that one? Or
I can take that. Sure.
Yeah, go ahead.
Yeah. Yes, MTS can create everything from the start to finish. We can set up that portal. If you don't have that established, again, we can set it up. We can create the message topics that you'd like. For example, you may want only certain questions from the patients, just refill requests, just clinical questions, and then we can set that up for provider and who receives those messages. You may want different users to receive messages for the refill requests and different users to receive the clinical question messages. We can set that up and continue to manage it. And you can, again, just let us know, I don't want Sally to receive this question anymore. I want Mary to receive it. And we can maintain that. You just send us that information and we can, again, maintain that, or any changes you have. If a provider leaves, set it up for a new provider. We can manage that.
Yeah. Very good.
Excellent. Just to remind the folks in the audience, if you have a question, you can enter it in the questions window in your control panel. Our next question for either Dr. Gary or Randy is, when you said that providers can access another provider's inbox, what do you feel is the best practice for managing a provider's inbox when a provider leaves the practice?
So when a provider leaves your practice, somebody is going to have to monitor that mailbox in their absence. And so it's not really much different than when they're on vacation, because there are things that can come through there that need to be handled, refill requests. And if that's not going to your MA, we need to talk more about that. But you really want to make sure that you set it up so that there is somebody who can handle or take charge of those messages to make sure that you're not blocking vital clinical information from moving through. So I recommend that you have a protocol that if a provider leaves, that there is either somebody who is another provider can take on those messages, or if you have somebody that will be responsible for then delegating those messages to other providers. It's really important that those things aren't dropped. Randy, did you want to add anything to that?
Actually, yes. What a lot of people don't think about is what happens after that provider leaves. That provider may have, if you have a lab interface, may have sent orders a month ago. And when those come in, someone needs to address them.
Yeah.
So those notifications come in, somebody needs to address those. We do have where we can set something up on the back end so that it automatically goes to X provider. Maybe there's another provider that's going to take over a lot of patients for that provider that left. There are things that a lot of times offices don't consider. And they think when that doctor's gone, they're gone. But there are still things that come in that need to be addressed. There are, like Dr. Gary said, that there might still be notes that are not signed off on, or results that are already there that have not been addressed. So it doesn't end when the provider just leaves. There are still things that come in that have to be addressed.
And with future orders, you know, the ability to set up future orders, a provider that's there today may set up an order for 6 months or a year from now. So you really have to think about what's going to happen when those results come through. You know, people think about the billing, but they don't think about the clinical workflows. So that's a great question. You have to have a plan, and you probably should have, you know, a policy or procedure on what your practice is going to do for that. Any other questions, Gary?
We do. So we've covered a lot, but for a provider or user who's new to NextGen, what do you think are the best time savers?
For a provider, I want to say, well, there's two things. One are phrases. There are common instructions that providers give to multiple patients, like maybe it's the same instructions depending on the condition, and there's no need to type them over and over again. And what's nice are there are many areas where you can save these. So it's not just one area. There is, of course, the plan that we touched on, generic templates for the reason for visits, telephone call templates. There are different areas where you can save these phrases. So you don't have to type these out over and over. Saving templates, such as the physical exam or the review of systems, you can save these, you know, depending on patient's age, you know, what condition. So it's nice that you have, I don't want to say unlimited, but are allowed to put in so many. So it's not just, you know, black and white. Oh, I may only use this for X or this for Y, where it gives you a lot of flexibility to create as many templates as you need.
Excellent.
Yeah, and I just want to jump in on that one before you get into the second part of what you were saying, Randy. But I call them accelerators. When I was with NextGen, I did at the annual user group thing on the accelerators, implementing the accelerators. Those are the numerous things that NextGen has in there that makes workflow quicker. And your providers have to take the time to complete those. I worked with a provider one time and they said, oh, it's too much time to do a quick save and a quick load. And I go, okay, so how often do you, and it was flu season and patients coming in with coughs and sinus stuff and flu symptoms. And I go, how often are you seeing patients at this time of the year with that? He goes, and this provider said, well, probably more than half of my patients. And I said, so are you really recreating the same stuff over and over again? And you think that's quicker than once saving a quick save and then, you know, bringing it in with the load and then doing the exceptions? As providers, we ask the same things, that we do the same things depending on the patient's symptoms or signs that they're walking in with, their chief complaint. Why not create these accelerators, have them on hand, bring them in, and then document the exceptions? For new providers, new on the system, giving them that training on how to do that and then having them do that on an admin time or when they have free time on weekends, give them time to set the system up so that it's faster for them. If you don't do that, they're going to say too many clicks, too time consuming, and they're not going to get ahead of it. That's one of the things that I find is most useful with new providers. Train them how to make their lives easier and how to bring that stuff in. Did you have more on that, Randy, for that question?
No, you're right. I have had where I've worked with, especially new providers, where I say I'd rather spend time with you and let's spend, and it doesn't take that much time, but you know, I say just take as long as you need, spend those extra few minutes, set those up, and they are thankful, you know, down, you know, even the following week that they didn't have to type, you know, things that they already saved, that they didn't have to retype it over and over. They do find it gratifying once it is set up.
Yeah, very much. Are there any other questions, Gary?
I am not seeing any additional questions, but briefly before we let our guests go, for those of you who may not be familiar with MedTech Solutions, on our next slide, you'll see that we're listing all of our services and products. For information about any of these services you see here, feel free to reach out to us or check out our website. It's medtechsolutions.com. If you'd like any additional detail about anything you've heard from Dr. Gary or Randy today, feel free to reach out to us. If you know your account manager, you can contact them directly, or you can email us at info@medtechsolutions.com. As a reminder, we'll be following up within a day or so with a link to today's recording so that you can review it and share it with your colleagues. Want to ask you to be sure to follow us on all of our social media platforms. You'll find MTS on Facebook, on LinkedIn, on Twitter. We have a YouTube page with a bunch of educational videos. I think you'll find something interesting there, and we encourage you to go visit MedTech Solutions page on YouTube. Big thanks again to Randy and Dr. Gary for a great presentation. Hopefully you folks can begin to put into action some of these great time-saving tips and strategies. Anything, last words from our presenters?
Randy, did you have anything you wanted to say?
No, nothing more. I just wanted to thank everybody for joining.
Yeah, I wanted to thank everybody for being here, and we have a lot of new offerings coming out at MedTech Solutions. So as Gary talked about all those different places to find out more about us, if you have questions, if there's something you're looking to do with your system and you need assistance, reach out to us. We have individuals that can help you make your system sing, make your providers happier, and really help move you forward with the use of your system. Otherwise, thanks a lot and have a great day. Back to you, Gary.
Thanks, everyone. That concludes our presentation today. We hope you have a great day. Thank you so much.